Hi guys, I am waiting for my mom to accept my request. And it's taking a little while because she's not very good at Instagram lives. We're going to be talking about all things COVID related. Thank you so much for checking on me, everyone who's saying that in the comments. Yes, I did get a haircut. That's why my hair looks like that. Um, I'm well, thank you. I'm in the US right now. I am away from home, so I'm really grateful that I'm here. I hope all of you guys are well, and I hope your families are safe because it's such a scary time right now, and I'm constantly worried. If you guys can DM my mom and get her on the live, please do because I'm trying. My health is good. Thanks, Niharika, for asking. I'm fine. I got the vaccine yesterday. I got the first shot. That's why I sound down. Oh, finally. Okay, hello, hello. Kita, it's so weird.
The
ऐसे,
volume is not that good.
um, can you hear me now?
I can, but it's very low. I don't know what to do.
थोड़ा सा तो सुनाई दे रहा है ना? Hey, Barkha, hi. सुनाई दे रहा है, मम्मा?
बहुत थोड़ा सा.
Okay, wait. मैं दूसरा लगा लेती हूँ. अब सुनाई दे रहा है? Oh, hi, Surya. Hi. हाँ. ओके, चलो लेट्स स्टार्ट आवर कॉन्वर्सेशन. मैं आपको जो क्वेश्चंस आपसे पूछना चाहती
नहीं
हूँ मैं
नहीं
आपको
डन हो गया।
व्हाट्सएप कर देती हूँ,
नहीं नहीं अब आ
तो आप आंसर करो.
गया।
आ गया?
ओके।
ओके, सही है. ओके.
यस।
ओके, सो हेलो, वेलकम टू माय लाइव. आई एम रियली हैप्पी आप आ गए हो लाइव पे. तो बेसिकली फॉर एनीवन हु डजंट नो, मैं यूएस में हूँ और मम्मा माय मॉम इज इन इंडिया राइट नाउ. शी इज सिटिंग इन माय रूम. So we thought we'll do some COVID related talking conversation. So yeah, so क्या चल रहा है अभी इंडिया में? What is the current status? And yeah, what is happening? And how are you doing
So
personally?
hmm. Yeah, so it's nice to be speaking to your daughter on Instagram live in front of so many people. But yes, good. Mm, Actually, I was desperately waiting for my son and my daughter to come, but now I'm actually feeling happier that they're not coming because the situation was so grim that it's very, very risky. And for all you people who are watching this, most important, please stay safe. Please look after yourself. That's very, very important. And the situation is so bad that we are actually seeing more than 3 lakh cases every day, and the unconfirmed statistics say that the number could be many more times than this. And practically also as doctors, when we see patients or when we talk to anyone, either that person is positive or someone in their family is
Yeah.
positive. So it's, I am yet to find a person where nobody is not COVID positive. So,
Oh God.
yes, for last 10 days, the situation has actually spiraled out of our hands. In fact, the whole country is actually falling apart because of all this.
या जब मैं इंडिया से निकली थी तो इट वाज एक्चुअली नथिंग कुछ भी नहीं हो रहा था इंडिया में एट दैट
Hmm.
पॉइंट सो द न्यू
Yeah.
cases on 24th are 3,49,000 which is great.
Hmm.
Anyway, so let's talk about productive stuff. Like what can you do? So if I get COVID or someone in my family gets COVID, what are they supposed to do in immediately?
Okay. Yeah. So, सबसे पहले तो let's first talk about what are the symptoms when you should be suspecting that you could be having COVID. This everyone knows. If you have fever, if you have pain in the throat, if you have dry cough, loss of taste, loss of smell, then yes, of course, please talk to the doctor and get a COVID test done. There are basically three types of COVID tests which are available. The most sensitive test or the most accurate test is the RT-PCR. So this test basically detects the genetic material of the virus, and it's very, very accurate. But remember, a negative PCR does not mean that you are not having an infection. In fact, it is said that loss of taste and loss of smell is equivalent to a RT-PCR test, which means even RT-PCR, if it is negative and you have loss of taste or smell, that means you have COVID. Then the second could be antigen test, which is rapid, which is less expensive. So the RT-PCR takes about 2 or 3 days these days because of the long TAT, but the antigen tests are faster, but they are not very accurate. So I'll put it like this: in case antigen test is positive, it means sure COVID hai. Lekin a negative antigen test does not mean that it is really negative. Then we have antibody tests. So that actually measures the antibodies in response to the COVID infection. So this means that that person has had exposure to COVID sometime back. Even people who are vaccinated after 2 doses should have a good antibody response and a positive antibody test. But the gold standard is RT-PCR.
Okay, and if someone is tested positive, so what are we supposed to do?
So number one, please, please do not panic. Always remember that the disease is likely to be mild in about 80 to 85%. The disease is likely to be like any other cold, any other flu, कि थोड़ा दिन जुकाम हुआ, दर्द हुआ, थोड़ा सा मैलेज हो गया, फिर ठीक हो जाएगा. But in about 15% cases, the disease might get out of hand. So if you notice any breathlessness, any increase in the fever, then you're supposed to immediately get in touch with the doctor. The doctor would probably order certain basic tests. The doctor might also ask for a CT of the chest. And in case the breathing is very, very difficult, there's a lot of problem, then the doctor might ask you for the admission to the hospital.
Hmm.
Yeah.
Okay, and say for
And one more thing I wanted to tell you was, please don't hoard the medicines. I have seen market से विटामिन सी गायब हो गया है, जिंकोविट गायब हो गया है, जबकि दोनों में से किसी की भी एफिकेसी प्रूव नहीं है. So whatever the guidelines say कि क्या चाहिए, खाली पैरासिटामोल चाहिए, you should be taking plenty of liquids, you should do a lot of steam, gargles, but vitamin C and zincovit actually they do not cause that much of a positive effect as it is believed to be. You are not supposed to take AZ and doxycycline. I know everyone is just popping these antibiotics like that. Remember, COVID is a viral disease. Antibiotics have got no role into it. Only if the doctor is suspecting a secondary bacterial infection, then we are supposed to give antibiotics. So just take paracetamol, drink lots of liquids, do gargles, do steam, and take plenty of rest. Any disease, usually by taking good rest, recovers faster. And do not get
hmm,
paranoid about it. In all probability, it's going to be a mild illness.
okay, um, okay, that's great. Say for example, किसी को बहुत severe symptoms हो रहे हैं, they need to be taken to the hospital. So, आजकल I'm also reposting my friends' stories and just all the DMs that I get. urgent plasma requirement, urgent this, that. So, what should we do in case we need to arrange these things for someone we know?
Hmm. So, in case the disease is getting out of hand, which means that person is having breathing difficulty and very serious fever, obviously, that person needs admission, person needs oxygen, the person might need
Mhm.
a ventilator also. And I really feel very sad and I actually feel very helpless that the situation is out of control. 2 days back, I was desperately looking a friend of mine who's very, very sick, and we had to find a bed for that person. I had spoken to all my friends, and still it was so difficult arranging that. I know it's very, very difficult, but we have very good, authentic government portals. We have a Delhi government portal. We have a Ministry of Health and Family Welfare portal. So you can log on to that. And they're doing a very good job. When I've seen their portals, they're constantly updating. So please keep checking. Please keep talking to your doctor. Ask your friends, and hopefully something will be arranged. I know it's going to be not that easy, but yes, remember, everyone is trying to help each other, even as doctors, and everyone. I mean, every day, despite my clinical job, I am treating 15 people on COVID, even though I'm not a gynecologist. I'm trying to search beds and everything for them. This is a situation in which we are collectively in, and we're supposed to help each other whichever way we can. So it's not easy. I fully understand this, but we need to understand when the enormity of the disease is so much that every resource or the every structure is actually falling apart. So the difficulties are going to be there. And I have seen, everybody is actually telling government ne ye nahi kiya, government ne wo nahi kiya. Yes, of course, the government should have been better prepared, but I feel we also, as a general population, we also should have been more careful. The history tells us that the second wave of any pandemic is likely to be more severe. So we somehow probably forgot to take all those precautions. So, we all are collectively to be blamed for the entire fiasco which is happening now.
Um, okay, so there are a bunch of questions जो मैं देख रही हूँ in the chat. Um, I will just ask you, okay, how exactly does plasma therapy work?
Hmm. So, the plasma therapy is basically they take the plasma of a person who has recovered from COVID, and that plasma is likely to contain antibodies. And these antibodies, if transferred to a person who's battling with a severe infection, might help. But we have to remember this is just a temporary treatment. This is not a sure shot way of treating the person completely till the time the person's own immune system takes over. So you have to understand that it's a viral disease. It's a self-limiting disease. But the problem is that this disease incites such a bad and a severe inflammatory reaction in the body that the person does not die because of the virus. The person dies because of the inflammatory response which happens in the body. So the plasma exchange would give the antibodies which will help this phase to be tidied over. And there's a lot of paranoia about a lot of medicines like remdesivir and all that. So please understand that everyone does not require all these treatments. We have strict guidelines as to who should be given this treatment. In fact, this should be given only in the first 10 days. Anybody who's gone beyond that, remdesivir does not work. It should not be given to people who are in home isolation. It should not be given to a person who's having mild disease. It's a drug which has to be, advised by a physician. Only then this drug has to be given. And of course, the hoarding and selling it is in the black market is absolutely just not done. By hoarding it, we are actually depriving a person who actually might need this. So thankfully, today I saw that the government has actually made sure that this drug is now not available on any medical store. No wholesaler can sell it. So the drug is now will be sold only on the patient's name after the proper prescription by a treating doctor, so that we know only the right beneficiary is getting the drug. And of course, by doing this, the drug will not be black marketed and hoarded.
Okay. Um, thanks for that. इतना awkward लग रहा है मैं आपको ऐसे thanks बोल रही हूँ. Okay, so Khushi says my dad is COVID positive and has oxygen 92. Should I be worried?
Hmm. So, if Khushi, your dad is stable, which means he doesn't have fever, doesn't have breathing difficulty, what you can do is you can just keep monitoring him. If he doesn't have any comorbidities, like he's not diabetic, he's not having high blood pressure or cancer, he's not obese, that means he comes into a low risk zone, no fever, 92 oxygen saturation, we can observe and monitor, but goes without saying, if you notice any deterioration, please do not wait. Call your doctor and then do whatever is necessary to be done.
Okay, and Janvi is saying, what if someone has fever after the first dose of vaccine?
Huh. So, a lot of people are having a little febrile reaction, we call it as, after the vaccine. It just means that the vaccine is has started doing its job, so which is okay.
Hmm.
And you have to just take a crocin, again take a lot of rest, take a lot of liquids, and all these symptoms are very transient. That means they would disappear in next 2 or 3 days. And remember to take the second dose. Remember that you take the same vaccine. And even after the vaccine, please do not forget to use a mask. Please don't forget to wash your hands and do all the protocols very, very seriously. In fact, I wanted to demonstrate the use of mask today. And I'm very, very particular about this because when I'm sitting in the clinic, I see patients coming to us with this mask worn in all different styles. So I thought I will demonstrate this. So the masks could be of various types. Now, simple is a surgical mask, which is a blue mask. It's a 3-ply mask. You all would have seen it. It usually doesn't serve anything. Second is a cloth mask, which is a normal cloth mask. Such fancy designer masks which have come these days. But remember, what you need is a protection. You don't need a designer accessory. That's very, very important. So now the current CDC guidelines, they say that you are supposed to wear double mask. Double, दो mask पहनने हैं. So एक के ऊपर एक. And then secondly, remember, the mask is supposed to cover the nose and the face and the mouth both. So ऐसा नहीं होना चाहिए कि nose अलग है, mouth नीचे है या mask नीचे है. So I'm just going to be showing you N95 mask. So N95, if you wear this is only one mask is sufficient, and N95 is something which covers the entire face. So always remember that you're supposed to hold it from the strings. You're not supposed to hold it like this and wear it like that. So you hold it from the string, put it up like that, and make sure that it goes nicely, snugly over your ears. Make sure that this fit is right. I've seen when this is so loose कि थोड़े टाइम बाद ये नीचे आ जाता है, ये यहाँ जाता है या यहाँ पे neck में हो जाता है. So remember that it is nicely snugly fit on your face. When you have to remove it also, just remove it like that. If you have to adjust your mask also, you have to adjust it like this, like that. अगर आपने यहाँ से touch कर लिया, then the entire purpose of wearing a mask is gone. Imagine if there's a corona sitting here and you touch it like that and then you shake hands with someone or touch yourself, then it's gone. Then there is no point of wearing a mask. So remember, correct type of a mask, correct fit of a mask, how to wear it, how to remove it, how to dispose it also. ऐसा नहीं कि उसको उतार के कहीं भी छोड़ दिया, आपने उसको टेबल पे रख दिया तो वो कोरोना आपकी टेबल पे चिपक जाएगा. So you have to hold it like this. You're not supposed to hold it like this. And now you are supposed to throw it in a closed bin. Remember, closed bin. And in case, ideally, these days we say that you must change your mask every 8 hours. in case your mask gets soiled.
then you are supposed to obviously change it earlier. If you are sneezing or if you're coughing, make sure the mask is on. So, I mean, I see such funny instances.
Is wearing the mask and suddenly the person starts feel like sneezing. तो वो क्या करेंगे? Sneeze करेंगे और फिर से mask पहनेंगे. I said, oh God, what is this? You wanting to save that mask or do you want to do what? So the mask etiquette, I'm so sorry that it's been for last 1 year and still we have to tell people how to wear a mask. So this is my serious request that please wear the mask properly.
So no cloth masks at all.
No, you can wear a cloth mask, but in case you're deciding to wear a cloth mask, make sure
Hmm.
it's a three-ply mask. It should be having 3 layers, and now CDC recommends that you actually need 6 layers. So they say that this new strain, which is a triple mutant strain, it's a little thinner virus, and it is likely to be suspended in the air, and it
Hmm.
can travel in those layers. But if you're wearing 6 layers, then the risk
of transmission is low.
Okay. Okay. Um.
सो या तो डो पहनना है या सिंगल N95 पहनना है.
Hmm. और उसे हैंड वॉश नहीं कर सकते. You have to dispose it.
बिल्कुल नहीं 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 बिल्कुल कर सकते हैं. सो जो क्लॉथ मास्क है उसको आप बिल्कुल हैंड वॉश कर सकते हो. एंड सो व्हेनेवर यू कम यू इमीडिएटली पुट इट इन नाइस डिटर्जेंट, लेट इट बी soaked for about half an hour, so nicely rinse it and dry it and you can do that. Yeah.
Okay. So a lot of people are also asking, and this is my question also. If COVID airborne now and it's not just surfaces.
Yes, yes, we have now new lot of theories which say that it could be suspended in the air also. So all these are changing every day. So pehle it was airborne, then it was surface borne, then it is
Hmm.
again surface borne. So I really feel let's be very, very cautious in our
Hmm.
approach. Surface, air, all the precautions. So which means that make sure that wherever you go, you are going, don't unnecessarily keep touching the surfaces and the table and the knobs. So if you do that, make sure that you're washing your hands very nicely. So earlier the recommendation was 20 seconds, but now it is 40 seconds. So if you use any detergent, make sure that you're washing it nicely. And remember to wash it like that also, 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 this also, this
Oh
also.
God.
So there are actually so many steps to this. Like that,
Yeah.
like that, like that. So yeah, you can find this anywhere. So it's very, very important to learn all this. We as surgeons, we are used to it. हम घर पे भी कभी हाथ धोते तो हम ऐसे ही धोते हैं.
Okay, so what should be uh, the routine when you're sanitizing? जैसे वो होता है ना, अगर ग्रोसरीज मंगवाए तो उन्हें कैसे सैनिटाइज करना चाहिए? ग्रोसरीज या बाहर से खाना मंगवाया तो.
Now that is a very difficult task actually. So actually we do not have any specific guidelines to this. Uh, whatever vegetables, let's talk about the vegetables and fruits because that's the most difficult part. So what is to be done is when you get them from outside, soak it in a proper you can say a bucket or whatever, nicely soaked. Let them be there for about 4 hours or so. Remove them, and then keep them out somewhere in air so that they are there at least for about 24 hours or so, and then only put them in your refrigerator.
And what about
For the
food?
other,
Like if you order food, ready to eat food.
huh, yeah. So what I would say is because you cannot use any detergent or maybe even hypochlorite solution or whatever. So what you do is that in case you order something, let's say from Swiggy or something, so first nicely wash your hands and then 1 second, my battery is about to go. Let me just. I
मैं
know my daughter is going to laugh there over this.
No, it's fine. नहीं, अच्छा मेरा रूटीन ऐसे था, like if I was ordering something कहीं से तो पहले जो उसका डब्बा है ना, मैं उसे खोल के आई वाज पुटिंग इट इन होम यूटेंसिल्स। फिर लाइक हाँ, सो आपको सुनाई दे रहा है?
हाँ, हो रहा है।
हाँ, so I was putting it in home utensils without touching the content of the food. तो सीधा ही डब्बे को पकड़ के मैं उसमें डाल रही थी and then just disposing of the box and then washing my hands and everything. तो वो सही
हाँ.
तरीका है या वो
So I
सही
would
तरीका
say
नहीं है?
wash your hands nicely and then open it. And once you've opened it and put it on the plate or something, again wash your hands.
हाँ हाँ
And then eat
वही
it. Yeah, yeah.
ओके अच्छा एक और
So
क्वेश्चन जो सब
it's
लोग
very
पूछ रहे
difficult,
हैं
but yeah, it's better to be cautious than repenting later.
एक और क्वेश्चन जो सब पूछ रहे हैं कि कैन यू वॉश N95 मास्क
Ideally, they are not supposed to be washed. But in India, everything goes through various cycles. But if you wash it, then I would say, you can soak it in a nice detergent or something, maybe half an hour or so. But ideally, they're not supposed to be washed again and again. I know they're
ओके
expensive and
या दे आर
hmm,
एक्सपेंसिव
yeah.
Um,
So,
okay. Mm, I'm just checking और क्या questions है हाँ if you're pregnant and if you get COVID then what do you do?
then also there's nothing to.
Worry, really. So,
We did a small video on the FAQs where the